bones and soft tissue injuries. A little review from last class period. We talk about the axial um, skeleton, and that's the axial skeleton is the skull, the rib cage, the vertebral column, part of the ischium here, the sacrum. And then the appendicular skeleton is the purple part. Those are our appendages or our limbs of our body, and the ilium here, and the ischium, pubic symphysis. Then we talked about continuing on. We talked about the main functions of the skeletal system. Main functions of the skeletal system are to aid in movement of the body, to support and protect internal organs, and to produce red and white blood cells. Which white blood cells, remember, lymphocytes. Red blood cells help carry oxygen around the body. We also use our bones to store minerals, for example, calcium, which you've been learning about since you were in elementary school, how it makes your bones hard and less breakable, more dense. Bones are made of microscopic cells. Those little cells are called osteocytes. The next thing we talked about the 5 types of bones. We have long bones, flat bones, irregular bones, sesamoid bone, and short bones. Those are the 5 types. And then the shape of the bone is what allows for different attachments to it and ways that it can articulate with other bones. All right, we had some photos here. We talked about 6 types of fractures. The first one was a simple fracture, just kind of straight across. It can be complete or incomplete. We talked about a compound fracture. The Kevin Ware photo is here. And a green stick fracture, which often happens in adolescents where their bones are a little bit more pliable than adult bones. This would be a comminuted fracture where the it breaks into 3 or more pieces is a comminuted fracture. Then we have stress fractures that can happen due to an imbalance or poor muscle tone. It happens over time. A chronic injury would lead to a stress fracture. Epiphyseal growth plate fractures. This is where there's a fracture along the growth plate. 10 to 16-year-olds whose bones are not fully developed, fully done growing yet. The picture right here shows the growth plates on a hand. An avulsion fracture is a fracture that rips off a piece of the bone when it breaks. We talked about acute management of fractures. Don't move them if they're not able to move themselves. Call 911 if necessary. Keep the athlete calm. You might cover that area so they don't go into shock if it's a major injury. And splint if you need to transport. There's internal and external fixations. We have fractures for fractures. This would be an external, a cast. You guys have all seen those. You may have seen something like this. This is internal, where there's rods and screws and plates. Today we are starting with 3 different types of muscle. We have cardiac muscle, which is the muscle of the heart. This type of muscle, and they're different because they work differently, but they also look differently underneath the microscope, which you can see pictures here of what those muscle cells look like. So cardiac muscle is of your heart. You know, a cardiac arrest is a heart attack, so cardiac means heart. The skeletal muscle is attached to and move bones. That's what we're going to be learning here next week. We'll learn many of the skeletal muscles. And then we have smooth muscles. The smooth muscles, like our esophagus, our intestines, our stomach, are smooth muscles. All right, so smooth muscles, not under conscious control. They're not attached to our skeleton. As I mentioned, the stomach, the intestines, the bladder. Cardiac muscles is the heart. It is not under conscious control. Our cerebellum controls these movements. And then skeletal muscle attached to the bone. The skeleton is responsible for moving the bones and giving us motion. All right, so if you continue to study exercise physiology, if you continue to study kinesiology when you go to school, you will have to learn the origin. There's over 600 muscles. You'll have to learn the origin of those muscles. That's where it starts at. So the origin is up here on the ischium for this hamstring. And then the insertion is down here. So origin, insertion. So I had this little book that I had when I was in college that we used to learn these things. But here's an oblique, and you can see, I think you can see there, the different things you have to learn. So the origin and the insertion, so where the muscle starts and where it attaches. The belly of the muscle is here. You don't need to know for class. We're not going to have to learn all these. You need to know what they are. Blood supply. What the blood supply is for that muscle. Innervation, so what nerve provides sensation to that muscle, and then what action that muscle does. Muscle attachments and functions continued here. Prime mover. This is the muscle that provides the most strength on a action. So for example, here there's a picture of somebody's biceps. When you do elbow flexion, you are using your biceps, but you are also using lots of other muscles for that will help that prime mover. But the bicep is the prime mover of elbow flexion. Antagonistic are muscles that work in opposition to each other. For example, the bicep and the tricep are antagonistic to each other. The bicep does elbow flexion, the tricep does elbow extension. So those muscles are antagonistic and they work in opposition to each other. Those muscles need to be similar in strength, because if you have one that's much stronger than the other, like a bicep or tricep or quads and hamstrings, that can lead to injury. Synergistic muscles. These are muscles that help steady the joint. So when I was talking about the prime mover, the bicep being the prime mover for the bicep curl, that is the bicep is a prime mover. There are a lot of other synergistic muscles. As you can see, there's over 600 here in this book that you will learn if you continue on. But there's prime movers and then synergistic, and then there's also antagonistic muscles. Muscle attachments and functions. So two things here, muscle atrophy and muscle hypertrophy. I know we talked about this in one of our intro units. I think when we talked about modalities, we were talking about atrophy and hypertrophy. But muscle atrophy, you can see in this picture here, this right leg has a lot of atrophy, probably due to a knee injury. And then you can see the left leg is more of a normal, well-developed a leg that we would think of. Here is atrophy as well. In the bicep, if there's a shoulder injury on this person, this part of their body is going to atrophy. Their arm is going to atrophy because they're unable to use it. They're unable to do exercises that will provide them the strength to gain that muscle mass back. So after a surgical procedure, after some type of trauma or just an injury, you're going to have muscle atrophy. It can happen if you're immobilized completely. It happens very quickly within the first few days and peaks out at maybe 2 or 3 weeks. By 10 days after a surgery, there is a large amount of atrophy in whatever limb is affected. Muscle hypertrophy we talked about when we did prehab. We talked about our prehabilitation unit. That is an increase in muscle size. And so when you're weight room, you're trying to increase muscle size. Your goal is hypertrophy of muscles. Hypertrophy is getting big. Atrophy is shrinking, decreasing, or wasting away of muscle. Injuries to muscles. We have strains. An injury to a muscle caused by twisting or pulling of a muscle or tendon. We have acute strain and a chronic strain. An acute strain is that it just happened. It was caused by a trauma. You rolled your ankle, you twisted your knee, you pulled something in your back, but this is an injury to a muscle. A strain is a muscle injury. We'll talk about springs here in just a little bit, but a strain is a injury to a muscle. Acute, it just happened. You're going to ice it. You're going to elevate it. You'll immobilize that area. And then a chronic strain is something that is an overuse injury. It's repeated, it's constant, it's prolonged, repetitive. Some symptoms of chronic strains would be pain, muscle spasms, because those muscles, they know that injury is there, so they start to spasm, and we don't like that spasm. It causes pain. Muscle weakness, possible local swelling. There can be cramping, inflammation, and also loss of muscle function. Because when a muscle is injured or there's a joint that's injured, the muscle is going to, the brain says, stop doing that. That's not a good idea. If you keep doing that, you're going to injure your body. So it sends a message to the brain and it shuts that muscle down. It will not allow you to do the motion. And that is why, in this case here, this is due to inability to gain strength because of that exact reason, that there's pain and the brain shuts down the quad and it won't let you do those exercises. Muscle tissue injury, kind of what happens whenever you're injured. This can be a surgery or if you just an injury to a muscle. Say you just pull your quad. So this is what good healthy muscle looks like. This is what a strained muscle. So if I strain my quad at soccer practice tonight, then the muscle wherever the injury is at starts to look like that. And then what happens is, it's kind of like, you guys have any brush pile. Not many of you are farm kids. But if you just keep throwing, here's my brush pile. If you just keep throwing limbs on top of, maybe there's an ice storm here in the city and we put limbs on, we just throw everything on. That's what happens whenever there's an injury to a muscle, and your body just throws scar tissue at it to try to heal that. And sometimes it can work pretty well, but it's all disorganized for a long time. And then over time, that scar tissue can start to lay down back into what we want it to look more like this. But you can see how it's all just discombobulated. It's just kind of a mess, all just thrown scar tissue together in mass. Treatment of muscle strain. So remember, we're still talking about muscles. The first thing we're going to do, the first stage of muscle strain treatment, is reduce the pain and swelling. So we're going to ice, we're going to rest, we're going to add compression to that area, and we're going to elevate. So you guys know the acronym RICE, R-I-C-E, rest, ice, compression, and elevation. In severe cases, they may use a hard cast or surgery for a severe muscle strain. The second stage, that's the rehabilitation part of a muscle strain. And this is an exercise program that involves exercises to prevent stiffness, improve range of motion, and that with that stiffness, some of that scar tissue that's laying down, remember, it's just your body's throwing scar tissue at it to try to heal it quickly. But that can impede on your range of motion. Also, rehabilitation is trying to restore the joint's normal flexibility and strength and reduce the risk of re-injury. That's why we use rehabilitation. How can we prevent muscle strains? Healthy, well-balanced diet is one way to prevent some muscle strains. Wearing properly fitting shoes and properly fitting equipment. Replacing worn-down athletic shoes, whether it's cleats or sneakers or basketball shoes, whatever it may be. Stretching, warming up and stretching before practice. Proper physical conditioning, so being in shape when you go into that season, so preseason conditioning. Proper warm-up is really important. I always give an example in class. When I was in college, I was late for soccer practice one time, and the coach was over talking to the trainer, I think, actually, and they were talking about an athlete, and I kind of slid in the back, and my team had already run their warm-up, and they were stretching, and I slid in. I thought I was really sly. I threw my bag down where nobody could see it, and I jumped in there. I started stretching. I think the only injury I had in the 4 years I played college soccer, I strained a quad by stretching a cold muscle. So warming up and stretching out is very important. Avoiding exercise or sports when tired or in pain, running on uneven surfaces, practicing safety measures to prevent falls. All those things can help prevent muscle strain. All right, brain break. Have you ever had a muscle cramp? Yeah, I think most of us have probably had a muscle cramp from time to time. In class, we could turn and talk. Maybe it was in the night you woke up and you had a calf cramp, or maybe like this guy here, you were in the middle of a game and you had a cramp and you just can't go. The muscle just clamps down and it cramps up. What common foods could help prevent muscle cramps? We've all heard bananas with the potassium is going to help prevent muscle cramps. Students usually say, oh, I heard pickle juice, some of those things. When your muscles are dehydrated, they're more likely to cramp. I think that's where the pickle juice comes from. Injuries to ligaments. So we talked about sprains. We talked about strains. Now we're going to talk about sprains. So very similar words. You've got to know the difference between straining a muscle and spraining a ligament. Sprains are injuries. Ligaments, remember, are attached bones to bones, resulting from a fall, a sudden twist, or blow to the body that forces a joint out of its normal range of motion. Symptoms of a ligament sprain is going to be pain, swelling, bruising, and loss of the ability to move or use of the joint. There's 3 grades of sprains. We have grade 1, grade 2, and grade 3. Grade 1 is a mild sprain caused by overstretching and maybe just slight tearing of that. There's no instability in the joint. It's still a stable joint, but there's going to be some pain. Most players will be able to play through a grade 1 sprain. A grade 2, some players are able to play through this, some players are not. Some players will come out of a game and would not return with a grade 2 sprain. There is partial tearing. So in that ligament, there's partial tearing. There is bruising, moderate pain, and swelling. There's some instability in the joint. So this is some athletes will play with a grade 2 ankle sprain or sprain of whatever. Other athletes will be done and not play with a grade 2 sprain. Grade 3, this is a severe tear or a complete rupture of a ligament. It's accompanied by severe pain, swelling, and bruising. ACL, anterior cruciate ligament, is one that I know you guys have heard of. I have a grade 3 sprain. This athlete is not going to be able to continue in the game. They're going to be very unstable. It's kind of with an ACL tear, you kind of feel like a baby giraffe where there's just no stability in that knee joint when you're trying to walk. So running would be virtually impossible if it's a complete tear of the ACL. So grade 1, grade 2, and grade 3. And we can use these same grades to categorize strains of muscles as well. Rehabilitation is similar to strains. Oh. We're going to change this. There we go. All right, damaged vessels. So this is an ankle sprain that you guys have seen. Many of you have probably had these. Just some pictures of what that looks like, the swelling, how it settles down in here. Injuries. We have tendons. Tendons attach muscles to bones, remember. Tendinitis, tendon. We know what a tendon attaches muscles to bone. And then inflammation, or the itis, is the inflammation of that tendon. These are often overuse or from irritation of that tendon. Treatment includes avoiding the aggregating movement, so rest, anti-inflammatory medications like ibuprofen, rest, ice compression, elevation, possible ultrasound, and then rehabilitation exercises. To prevent the return of tendinitis, which is something that can be chronic and it can plague an athlete for an extended period of time, you need to slowly increase the intensity and type of exercise. Mr. Snow sees some of this when track athletes, maybe they sit around all winter, aren't doing a whole lot, they can't get outside, it's not nice. So they're not doing a lot of activity, then they go to track, the first day of track tryouts, and there's a lot of tendon issues because they're doing too much too soon. They haven't slowly or gradually worked themselves into that position to be able to run at that speed or that pace. Injuries to muscles, we have contusions. A contusion is just a name for a bruise. It's an injury resulting from a direct blow or force. You can see this bruise here. We've all had bruises. It often doesn't interrupt the skin. Here's another bruise down here. Symptoms of swelling, pain if you touch or if you poke on that bruise, it hurts. Redness, ecchymosis. Ecchymosis is the discoloration. So you can see some ecchymosis in here, not as much in that one, but it's the pretty colors, the yellows, the greens, the blues and blacks. Ecchymosis is the bruising, the color of the bruising. Treatment for a bruise is rest, ice compression, elevation. If a contusion is not managed properly, there's something that can occur. It's called myositis ossificans, and this would be a severe or a major bruise. What happens, myositis ossificans, so there is bone that starts to grow within that muscle. And that would be very painful. They have to sometimes go in and take that calcification that forms out. So there's a lot of massaging that Mr. Snow would do on a major bruise to prevent myositis ossificans. It's a calcification that forms within the muscle. It can occur usually requiring surgery to repair or to remove that bone that has developed. Bursitis. Let's do this last one. Bursitis, inflammation of the bursa. We have bursa sacs in and around all the joints of our body. Bursitis, or inflammation of these bursa sacs, often resulting from repetitive movements or prolonged excessive pressure. Treatment for bursitis is avoiding the activity that caused it, applying anti-inflammatory medications, and if necessary, draining the bursa. An injection, a steroid injection, may be a possibility as well, and surgical excision would be in extreme cases. How to prevent bursitis from returning is strengthening the muscles around that joint, preventing those repetitive movements that are causing stress on that joint, and then providing some cushion for that joint to protect it. All right, we will end there for today. Part 3, you will have loaded soon, so you guys will need to watch that and finish your notes. Have a good day.